Thank you, Jacqueline. As she mentioned, Colby Ford is right next to me. He is my technical co-founder. If you have technical questions, please ask Colby. He knows 1,000 times more about technology than I do, but I think I'm the visionary and the dreamer of the two of us. But I will share my screen really quickly and then present. And if anybody has any questions while I'm talking, please feel free. But I think I look forward to having a discussion afterwards and just answering anybody's questions and figuring out how I can support anybody up there. Okay, so can everybody see my screen? Okay, great. Oh. Okay, so what we realized is that there are roughly 13 million caregivers in the United States who provide unpaid care for loved ones. And we know that it is a job that usually falls on, the average person is about a 53-year-old woman. And they are experiencing a massive amount of stress and worry. And you guys can see all this, can't you? And burden. And so we also know that these individuals are wandering and falling, and there's a lot of safety issues associated with dementia. And these individuals also are trying to age in place. And we also know there's a tremendous lack of longitudinal data for research. So we spent about 3 years looking at the problem before we started even building something. And why is it? Sorry, I was just telling Jacqueline I'm using a brand new platform, so I don't know why all this stuff is showing up. But essentially, we got funded from the National Institutes of Health to develop a application for a smartwatch, and we first decided to build it on the Apple Watch. And that application also sends information to a mobile phone for caregivers. And then at the same time, as Jackie said, we're building an analytics platform so we can collect data from the watch, aggregate it in one place for future research. That will support building digital biomarkers, looking at broader population health. And right now we're looking at developing research partnerships across the country and eventually around the world as we grow. These applications are currently not available to the public. They will probably be available later this fall, maybe in the winter. But as I will say, this application is the biggest issues that I'm concerned about are privacy. And so we need to make sure that that is nailed down before we launch it. The benefit that we provide for caregivers, we know that some individuals are taking 3-minute showers because they know their mom is going to wander. And so they lock all the doors, take a quick shower, and then rush downstairs in a towel to make sure their mom is there. Other individuals are concerned that mom or dad or a loved one might fall, and they get approached, by that individual that says, John, I fell. And you're like, Mom, you fell yesterday. No, I fell again. And they get confused. And so caregivers are constantly bombarded with this information. They don't know, did it happen today? Did it happen yesterday? Are they recalling something from before? And so it's available on the Apple Watch. There's fall detection, but we want to be able to, that fall detection sends it just to the individual wearing the watch. We want to be able to share that with other people. And then also understand, using machine learning, what happened right before that? Can we understand, can we predict when wandering happens? Can we predict, what led up to a fall? So, so the benefit to caregivers is just, having more peace of mind of understanding, what's going on at home, monitoring an individual's sleep and understanding, are there other things that we don't see with our eyes, like an abnormal heart rate? And then the other added benefit is being able to let a brother or a sister, maybe they're not even in town, but also have this information on their mobile phone so they can have situational awareness. A really quick story. I know a woman, and she said, I'm always caring for my mom, and my sister wants to do something, but she's in another state. She never knows until I tell her 2 days after the fact that I spent the entire night at the hospital. Well, if she had known, she might have been able to cook dinner or have dinner sent via DoorDash to that family, or called her sister to say, hey, do I need to come down there and give you a break? So, spreading that burden of care, within families or neighbors is really important. And then down the road, we want to use machine learning to understand, the timing when people go to the bathroom, when do they have incontinence issues, and can we prevent that kind of information? Can we share this information with doctors so individuals are not having to record everything down? All of that would just be sent to a doctor. But the thing that we're really, really excited about is research. If you look on the left, all these different research applications have been built, but nothing's been built for Alzheimer's disease. Apple is currently working with a couple medical companies, drug companies, on some research, but we believe we're going to be the first ones to actually build a platform that's collecting data just specifically for individuals with Alzheimer's and dementia. So this will enable more people to participate in trials. We know that so many people don't even live near a facility to participate, or it's so burdensome to go in, get somebody dressed, get them in a car, take them somewhere every month to participate. So, people will be able to wear a watch and participate in trials from the comfort of their own home. As such, this is going to help researchers lower the cost of conducting these trials, enabling people from across the country to do it, and also enable people who've historically been underrepresented to participate in these trials. The other beauty is all this data is passively collected from a watch. There's no need right now to self-report information. We're just following all of that behavioral and biometric data that comes off the watch. This is less obtrusive, and data comes in real time. And as I said, larger sample sizes. So, historically, most data has been done on Caucasians, but we know that Blacks and Hispanics are at a 2x larger chance of developing dementia, and we don't have the data. So this is going to help improve that. So 2 years ago, roughly 2 years ago, our company was funded by the National Science Foundation here at UNC Charlotte to basically start this research. And then last year, we were funded by the National Institutes of Health to build this application. We'll spend the next 12 months working with some families to do user experience and user interface to ask them, what is it that you want in an application? We have a really good idea because we've connected with more than 500 families already. And, we waited to build that until we got information from them, but we're sitting down with them and giving them watches and giving them phones and sitting them down in front of a computer and saying, what's really important to you? How do you want to see it? How can we make this better for you? And so, we still love connecting with families and understanding how we can provide them a platform to improve the care for their loved ones and reduce their stress. And the other thing we're currently looking for right now are individuals, researchers, academic researchers, medical, who want to help, who need help. We know that so many people, researchers will spend years developing a proposal to get funded by NIH or NSF or other institutions. And it takes a long time to get funding. And then once they get funding, it's expensive to build technology to collect data and then buy wearable devices. So, what we're looking for is people where we can say, hey, we have the platform, we can give you the data. Let's work together to find these insights to build digital biomarkers and understand how we can improve health. So at the end of 2023 is when we'll probably release, in 2023 is when we'll probably release our application for widespread use amongst the public. As I said, our main goals at this company are to advance population research, to understand why people are developing the disease and how can we help caregivers. And then the biggest goal is how can we prevent and delay the disease. I believe that a lot of things that we do in life exercise, sleep, behavior, diet, those impact our progression of the disease. I'm open with this. I actually have dementia. I don't know why. It's probably stress related. I have early onset Parkinson's. I have no idea why, but this is kind of what precipitated me to do this research. I was roughly 41 when I got diagnosed, but I want to understand how we can help other people in the future to change their behaviors so they can live longer and healthier lives. So here's my information. If anybody wants it, please feel free to reach out. I think Jacqueline will also share this, but I look forward to connecting with you, answering questions, and seeing how we can help Alaska, all the groups up there, to improve caregiving, the safety of our loved ones with dementia. And if there are researchers in Alaska or around the country that are looking for partners in technology to help them collect data for their research, we're all ears.
You're muted. Thank you.
Thank you. But Melanie knew what I was talking about. I asked everybody to give John a virtual round of applause. So thank you so much, John. I'm super fascinated. I'm going to sit back and see if there's any questions in the audience. Is there anybody who would like to ask John a question, or Colby?
Hey, John, Allison. Oh, you go ahead. I'll chat in after.
You go.
Oh, okay. John, really nice to meet you. I'm Allison Schreier, and I'm here today in two capacities, three capacities. One, I love Jacqueline, but the other two capacities are that I'm with the University of Washington with the Memory and Brain Wellness Center, and I'm a co-founder of a project called Zinnia TV. But with wearing my UW hat, just everything that you're speaking about just really resonates and makes so much sense to me. And certainly, we now know, right, that like 35 to 40% of people who are living with dementia have a disease that was probably preventable. So figuring out like, what are those lifestyle ways to both prevent and slow down progression are just so vitally important. And keeping people healthy for as long as possible really matters. So I appreciate the work that you're doing. We are involved in a research project with my Zinnia TV stuff, and I really look forward to touching base with you offline to see how we might be able to do some work together.
No, thank you. I appreciate it. I look forward to connecting.
Thank you so much, Allison. Lizette, what was your question?
Actually, it wasn't so much a question. It was ruining the fact that we don't have Alzheimer's of Alaska online today. Pam Kelly, the leader of Alzheimer's in Alaska, is a phenomenal leader. Amy, are you with Alzheimer's?
I am. I am in education. Yes.
So you go and then I'll come back in.
Yeah, I'm one of the education specialists here at the Anchorage office at Alzheimer's Resource of Alaska. And Kay, our education director, Kay Papacristo, she couldn't make it today. And she said, hey, Amy, could you pop in on that meeting? And that was just like a few minutes ago. So I'm super glad. Thank you for mentioning us. I am here. This is really relevant to what we do as an agency. I see Sheila's here also, who's doing some contract work with us as well. So this is all very relevant and pertinent, and I am really very glad to be here. Like I said, I just kind of stepped in and I'm just taking it all in. I'm excited about what you're doing, John. Thanks. Thanks for sharing.
We've actually had a lot of support from the Alzheimer's Association. Having gone to AIC, I sit on a couple of PIA groups, technology, dementia, data analytics. So, it's been so important for me to be involved with so many researchers, because Colby's got a PhD. I do not. Actually, my background, I did special ops in the Navy for 25 years and protected the president. And then the last part of my career, I was doing advanced research at MIT. But it is being surrounded by, caregivers, individuals with dementia, and the doctors and the researchers that enlightened me so much. I just was a sponge listening to everybody. And so it's been exciting to communicate with everybody. And like I said, I love connecting more because I learn about new research that people are doing. And I'll say strange, but just the incredible things that people are doing, and how it can be so beneficial for all these people, caregivers and patients alike.
Well, and I'm interested too. I mean, research is an important piece. And also, I just want to say also that Alzheimer's Resource of Alaska, we're actually a separate agency from Alzheimer's Association. So, great. I mean, Alzheimer's Association, they're so great, connect with them. But then we're a little bit different. And sometimes people think, oh, I talked to them, but they didn't, because we're Alzheimer's Resource of Alaska. So I like to let people know that, yes, please connect with them, but connect with us too, please. We're here specifically for Alaskans. I'm curious about, like I said, the research is interesting, but also how this tool can be useful to the caregivers and people living with dementia that we serve, and the one agency that came to my mind when you were talking about this was ATLA, Assistive Technology of Alaska, which is an agency that we also work very closely with. So someone calls and they'll say, I'm looking for some technology to help because my mom's falling and I'm concerned that I'm missing that. We do provide some consultation for that. But we also refer a lot to ATLA, Assistive Technology of Alaska. They might be interested in your technology that you're developing as well. Yeah, I don't know. Maybe you've all reached out to them before and they just couldn't make it or not.
We have before, but not for Amissa. So this is a good reminder that we should do that, Amy. And the other issue that I want to talk about, or the other opportunity, is that Health Tie is involved with the Dementia Action Collaborative. Sheila is a part of that, and so is Carolyn Hogan. So there's lots of possibilities here. Lizette, did you have another question that you wanted to ask? Please.
Well, and actually I had two things. I just want to thank you from the bottom of my heart for your work. My dad had Alzheimer's, and I think my mother passed earlier than she would have without having to carry the burden of his care for the last 2 decades of his life. He had Alzheimer's. His body stayed fairly healthy when his brain was completely gone. And so this is just really a powerful, just thank you. On a really heartfelt level, thank you. And the other, Amy, I'm just so glad that you spoke up. I'm so glad I said something and you stepped right in, yes. But the other thing I was thinking about, John, was I wonder if you've connected with AARP. AARP in Alaska is a very strong organization. It just seems like such a logical connection. And I'm just wondering if that connection has been made.
I've not connected with the group in Alaska. However, I am connected with the technology team in Washington, D.C. So I will obviously take that on board as a strong recommendation.
I really recommend it. Our AARP is very strongly led by Teresa Holt, and I think this would be something that she would be very interested in. And that would be just such a powerful place to reach out as well.
Great.
Yeah. The comment about your mom, passing early, and to Amy's point too, when we talk about caregivers, not only do we see an opportunity to collect data from an individual with dementia, but it's very easy if they have another watch. We know that a caregiver wakes up when their loved one gets up. Now they're getting interrupted sleep. We see an awesome opportunity to say, what's impacting your health now? It's not only just the person with dementia, it's the caregiver. It's, the stress and measuring all of that. We also know from these conversations, so many women have told me, in the back of my mind, I'm sitting here caring for my mom for 5, 10, 12, as many years as it is. And they're like, this is going to be me one day. And I see an opportunity for me to download this application as a patient, or and start giving my data so I can understand how do I prevent it for my daughter, for my son. So we're really excited about it. It's going to take so much time to get all this done, but it's just incredible that we have wearables, and soon I see this, the vision is Alexa and all these other sensors in our house are being understanding our behaviors. So it's incredible, but it's got to start now.
I completely agree, John. And one thing I really want to focus on is what we as a community, you're at a really interesting part or stage as a startup. So not quite ready to release this to the public, still doing your research. What can we do as a community for you?
I'd say, I love talking to families who are either recently, they were caregivers or they are now, to understand what is bothering you. I can't solve everything, or we can't solve every problem. We absolutely know that. People come at us and say, wearables are not the answer. My mom won't wear a watch. She won't wear a smartwatch. She won't charge it. I get it. But we look at the future. There are a lot of early adopters now. We also look at the people who are 60 and 70 now are wearing watches, and they are going to be the people who are going to be, needing help in the next 10, 20, 30 years. So I want people to tell me why I can't or we shouldn't be doing this. But I also want people to tell me, have you thought about this? Interesting. I'll make it really quick. A young man, he's not young, he's a little bit older than me. He's 50. He was going through Alzheimer's while his mom was going through Alzheimer's. And he told me that, right before his mom died, his mom was stoic, just sat in a chair. And he started singing to her, and, she started smiling and tapping her fingers and tapping her feet. And he could see a humongous change. The power of music. When I connect with people and they tell me stories of music or dancing or whatever, we think about, can music potentially help people come out of a fog? If we can realize that somebody is pacing or they're in a fog, if we can get an Apple Watch or turn on a device in their house to start playing music, will that make them more comfortable? So just understanding all these, interesting stories that people have, and, it just helps us to build a better product to help as many people as we can. So, people can reach out to me and set up a time to listen. I love hearing stories. Researchers, if there are researchers that want to tell me, their pains, they don't know how to organize their data, or they need the data, or, just what they're working on, that's opportunistic. Colby, do you have any other thoughts?
I think as we start to roll this out, the key will be rolling it out small and collecting feedback. So that's actually what our initial grant is on. Our initial phase is that we're working on a prototype of the application. Our backend technology suite is working quite well, but we're working on what do people want to see? What do people want to track? What do people want to be notified if something happens? Do you want to be notified with falls? Do you want to be notified with wandering? Do you want to be notified if heart rate is above a certain threshold? There's things like that that in our first phase we're going to collect some of the information. But it's just usability and collecting feedback on the platform, because the users for our application may not be the same demographic of users that use Instagram or Twitter or any of these other kind of popular applications. And so understanding how to design the application so that we can give the most information in the most digestible form, so that it's the most helpful we can, that's really a big goal for us. So as we start to roll out our initial versions of the application, anyone that wants to try it, that's something that we should certainly connect on.
Wonderful. With Amy here today, I can see that there's some potential to maybe make some connections to families, and certainly a opportunity for us to stay engaged and see when you're ready to have more pilot projects. Perhaps that's something that we could do here in Alaska. That would be wonderful. One thing I wanted to speak to, we went by it very quickly, John, it is really difficult to have an early diagnosis of Parkinson's and to be facing this and things. And I just want to acknowledge your courage in how you're doing that, but also the way that, when I meet care entrepreneurs all the time, there's usually a reason behind their passion. And if it's not them, it's a family member or somebody like that. So I just want to say I'm sorry, but thank you very much for putting that, challenge in your life to the benefit of other people.
I appreciate it. Actually, I started this before I even had Parkinson's, and
Wow.
these serendipitous events happened. But no, I appreciate it. And but that I started this, and then I was like, God, and it's so funny. People ask me, why are you not researching Parkinson's? As most people know, there's no money in Parkinson's. There's no money there, all the research is in Alzheimer's disease, and they're so relatable, and we can build this and it can translate to Parkinson's very easily. So if you can, there is an app for Parkinson's right now. It's not, I don't think it's very good, but but it's yeah, we can use these behavior monitoring applications to do the same thing, and it's going to transfer to other things in life as well.
Awesome. Thank you. I know that there's one other person who had a question. Melanie, did you have something that you wanted to share?
Not at this time, but thank you so much for the presentation, and I'm very excited to see this in the market. My grandmother has dementia. She is in a facility or in an assisted living home, but I see a lot of potential for this, so thank you.
No, you're welcome. I would add this. I think the other opportunity that we see, and this can take a while, but we've connected with physicians who say, I only see my patient maybe every 6 months, every year, because we all know how difficult it is to get a person in the car. Depending upon where you live, you're lucky if it's close by, but even getting somebody in the car to go a short drive is difficult, much less on a longer drive. So I don't see my patients very often, and they want to understand. I want to understand what's going on with them more than once a year. I also want to understand if I give them a medication or if I prescribe some intervention, is it effective? I don't want to wait a year for it. And being able to remotely monitor somebody's health in biometrics will help them, improve them, and could save their life if they change. If their blood pressure changes dramatically, or their heart rate, or they're falling in or fainting, or slipping because of whatever's going on. They need to know that. So if there are physicians that have ideas on how to improve that information to them, what we absolutely don't want to be is another page that physicians have to look at. We want to help build visual analytics where they can look at a patient's history, on one chart. So that is something that's going to take a while, to incorporate into electronic health records. But if there are physicians and other medical providers, nurses, et cetera, that have ideas, to improve their patient care, I'm all ears.
Wonderful.
This also goes to, this also goes to, as we know that there's the one Alzheimer's medication that came out last year that was wrought with controversy, but as new medications come out, it's also part of that as well. Side effects, things like this. We want to improve the lives of Alzheimer's patients, even if we can't save them. It's like make their life as good as possible. And then if we can understand how these drugs slow the progression of Alzheimer's, if they do at all. And I think that's just super important for maybe not just our generation or the current generation of Alzheimer's patients, but the future generation of people that will have the disease as well.
Thank you very much, Colby. So